What is autism? Autism is a severe developmental disorder with impairments in social interaction and communication skills combined with rigid repetitive behaviors. This condition is also called autism spectrum disorder. Autistic people see, hear, and feel the world differently to other people. A child with autism may appear unaware of his surroundings. Autism occurs in all racial, ethnic, and socio-economic groups. Autism symptoms tend to appear between 2 and 3 years of age. Autism is 4 times more common in boys than in girls. Autism is a spectrum disorder, meaning its effects vary from person to person. No two people with autism have the same symptoms. The severity of the disorder can range from mild to severe. A child with mild symptoms may be able to communicate or create social relationships, whereas severe cases can show the inability in establishing friendships, language skills, or motor skills and require continued specialized support. Causes of autism. No single known cause. Genetic factors, higher incidence among monozygotic twins, prenatal and postnatal exposure to environmental toxins, metabolic disorders, children born to older parents, brain chemicals, brain infections and abnormalities in the brain structure, certain infections and use of alcohol during pregnancy, parenting influences and social environment. Types of autism. There are four main subtypes of autism caused by different combinations of genetic and environmental factors. They include autistic disorder, also known as classical autism, childhood disintegrative disorder, pervasive developmental disorder, not otherwise specified, also known as atypical autism, Asperger's syndrome. Rett syndrome is no longer considered to be a subtype of autism. Signs and symptoms. The symptoms of autism can vary widely. Some children with an autism may demonstrate poor eye contact, whereas other children may demonstrate good eye contact. Autism can be accompanied with physical health problems such as sleep disturbance, seizures, and gastrointestinal distress. The main areas of difficulty are in social communication, social interaction, and restricted interest in their environment and repetitive motor movements, lack of eye-to-eye contact and want to be alone, lack of empathy and fear, gets upset by minor changes or difficulty dealing with change, lack of interest in peer relationships, significant cognitive impairments, pica, that is eating non-food items, sensitivity to light and sound, echoes words or phrases, doesn't know how to connect with others, play or make friends, inappropriate attachment to objects, spins objects, inappropriate laughing or crying, poor speech, dislikes being touched or kissed, does not respond to his or her name, no separation anxiety, aggression, headbanging, biting, hair pulling are common, seizures, self-injurious behavior. There are no medications that can cure autism or all of the symptoms. However, there are a variety of medications that can treat some of the associated symptoms. Early detection of autism spectrum disorder in children is important to reduce the problems and to promote the child's development. The parents of a child play a crucial role in supporting their child and improving their skills. The main goals when treating children with autism are to improve social skills, language and communication, daily living and motor skills, and modify behaviors to increase quality of life and functional independence. The earlier a child is treated, the better the prognosis will be. However, the majority of autistic persons remain impaired to some degree in their ability to communicate and socialize. Medications may be prescribed to treat associated symptoms or conditions associated with autism spectrum disorder. Therapeutic interventions such as applied behavioral analysis have been developed to help build a variety of skills. Speech and language therapy for difficulty in communication. Occupational therapy helps improve the quality of life so that they may participate in routine daily activities. Behavioral therapy reinforces positive behavior and helps the child to interact with others. Self-management helps an individual learn to independently regulate his behavior. Most autistic children require special schooling. Few useful tips to interact with your child. Develop a regular routine. Teach simple self-care skills. Teaching different ways of effective communication can reduce anxiety and improve behavior. Use simple language, speak slowly and clearly. Support and encourage the child to interact with others. Encourage the child to express his needs and look at the child's face and try to maintain eye-to-eye contact. While addressing the child, use his name so that the child realizes that you are talking to him. Keep background noise to a minimum. Give some extra time so that the child can process the words spoken to him. Thank you.